A very good day to everybody. We are now starting the session entitled Life and Risks in the Time of COVID-19, a 2021 Global Outlook. And with us at this session, we will be interviewing Dr. Cai Glushak, who is the International Medical Director and Chief Medical Officer, AXA Assistance and AXA Travel Insurance. Good day to you, Doctor.
Nice to see you.
Well, without further ado, let's jump in with the questions that we have for you. And let's start off with a general question, which I'm sure you've been asked many times. As a seasoned healthcare professional, did you ever expect this virus to have morphed into something so material globally?
That's a tough one to answer, but to be quite honest, we've been waiting for something for a while. I think those of us who've had to deal with global emergencies, outbreaks over the last few years, and for those of you who don't know, the role of AXA Assistance is that we support the travel and business community in terms of medical assistance, among other types of assistance, all sorts of travel assistance, and we're always positioning ourselves to respond both to individual emergencies and large-scale disasters and crises on behalf of our clients. So we're always vigilant and watching the situation. I think over the years, as I've dealt with a number of crises of various sorts, natural disasters as well as outbreaks, and especially the Ebola crisis that took place, I believe it was in 2013, we learned how vulnerable we are to the spread of disease in this modern age with so much mobility. And we got that one under control, thankfully, as easily communicable as it was. So I think we felt that at some point we would have to deal with a virus or other form of infection that could easily spread around the globe. When this first started, we were all hopeful as to hanging on to the reports that there was no human-to-human spread. That was coming out of Wuhan initially. But as soon as we started to see that that was not true, and we've learned the signals, as soon as somebody showed up across an international border, we knew that there was potential for spread. And so I would have to say that it didn't surprise me that it essentially got out of control.
Well, yes, you're quite right. I think everybody was surprised as to how it has affected the whole world, and it's probably going to continue for some time to come. But we'll talk about that later on as well. I think one of the things that's always in the back of our mind is that how COVID-19 has impacted and changed us. And I'm curious to know how AXA and AXA Partners as an organization have dealt with COVID-19.
Yeah, well, as I said, we're always vigilant for global crises, local global crises to outbreak. And so AXA Partners, sorry, I use the word AXA Partners interchangeably with AXA Assistance. We're actually now called AXA Partners. And AXA Partners has made a regular practice of crisis planning and as well as pandemic planning. This we really got primed on, as I said, during the Ebola outbreak. And so we're generally perhaps a bit more prepared than the average business entity to ramp up for this type of thing. And then there's, of course, the bigger AXA community, which is an enormous insurance conglomerate with some 150,000 employees and contractors around the globe. But we have crisis cells ready to go. Security has become an ever-increasing focus of the whole organization. And so we pretty much went into gear very early in March, after the first reports that things were starting to spread from country to country. We quickly updated our pandemic planning. We looked very closely at what was known about the virus, the mechanism of spread, and put into place a robust plan to be able to convert, first of all, to work from home as quickly as we could. That involved far more things than just medical actions, because it took a lot of re-engineering, particularly on the IT point of view, that most companies have now addressed in the meantime, a lot of security issues as well. But then our first priority was to protect our workforce and to make sure they remained safe and healthy. We went into all sorts of things like giving guidelines and trying to identify who are our most vulnerable employees, their dependence on public transportation. We built up stocks as quickly as we could of protective equipment, mainly masks. Were not easy to find at the beginning of this whole thing. And then really made some very rigorous protocols and planning for how we would phase either going back into the office or scaling back to lockdown. We went, and it worked well, to be honest with you. We saw very little business interruption as a result of moving very quickly. We learned a lot from it. We've had a lot of challenges through the whole thing, but we managed to keep business running pretty well as a result.
Well, that's good to it's good to know. That's good to know. And as a doctor, I'm sure you have a view on how COVID has impacted the healthcare systems, both public and private. What is your initial take as of to date?
Yeah, well, initially, obviously, it was quite devastating on pretty much all health systems that were directly impacted by COVID, because nobody expected the surge of cases and the severity of illness at the beginning. We've learned a lot since we've been dealing with the disease as to how best to treat patients. But in the beginning, it was really overwhelming hospitals. They had to redeploy all sorts of services. Their regular business activities and healthcare activities were very disrupted. In many situations, routine medical care and elective interventions like surgeries had to be postponed. Cancer patients weren't able to access their chemotherapy on a regular basis. It was very disruptive to all aspects of healthcare. Everybody made rapid shifts, particularly moving into the telemedicine space very quickly. A lot of ambulatory medicine, which would normally have been handled in person, was shifted to some form of telemedical support in a way that's kind of been an interesting thing and has advanced the whole domain of telemedicine rather quickly. But it was very disruptive in other respects. Many healthcare workers were sickened, and there were quite a few deaths amongst them in the early phases of this, when there wasn't enough personal protective equipment to go around as well. Then I think that it kind of went in different directions depending on the nature and the financing of the healthcare system. So public systems, primarily public socialized systems, had their ways of subsidizing their healthcare services, and they are impacted in a different way from private systems. As many of you who work in more privatized healthcare systems, these are usually more or less fee-for-service based. So the revenue streams for especially the hospital services that depend on admissions and procedures were very heavily impacted. We saw in the United States and some of the other private systems downsizing of some of these entities, at least temporarily. There were many layoffs in many of these institutions because of their revenue being cut off. I don't think it was the same in the socialized systems necessarily, but they obviously were strained as well, having to pump resources in to prop up their activities as well.
Didn't you see a greater working relationship between the public health sector and the private sector in sharing resources and coming together, or they just kept it very separate?
I would say that at the beginning, the public health sector got a lot of credibility when they stepped in and pretty much laid out the necessary interventions that we'd have to take to get the disease under control. They were very highly respected, and they got a good response from the business community and government overall and policymakers. Then I think as the epidemic continued, and we saw that it wasn't going to be a short run, that some of these interventions in order to stem the spread of the disease were necessary to continue for a longer term, the strains have started. And I have to say that in some environments, I think it differs from country to country. It seems to me in many parts of Asia, you have had more of a confluence of public health with government policymakers, and I think businesses tended to follow in a more cooperative stream. So has the population in general. But you see in other parts of the world, namely the US, now we're seeing in Europe as well, the strains are getting very tense, and the pressures that the public health measures are placing on society in general have caused a considerable division, and in some cases, a division between the good intentions of our public health advocates and essentially the economic impact of putting in place those public health measures. And it is not a comfortable feeling in many of our practice environments.
Yes, yes. I think you raised the point in Asia. We have a tendency to be a little bit more obedient in these parts of the world in Asia compared to what we in Asia are looking in the West, where the views are expressed very, very loudly at times. And it does cause some concern when we watch what's going on there and those views being expressed. But anyway, it is what it is. Part of this COVID-19 impact has created a lot of changes. Like you mentioned, the migration to telemedicine is one area where technology has always been there, but it has now been of greater import. So now the new normal of working from home, case in point, yourself and myself, where we are conducting this session at home, and it has brought about interesting challenges, I suppose, when we are working from home, because some are enjoying it and some would find it quite depressing. And there's issues of mental health and need of psychological support and risks related to travel and entertainment. What are your general thoughts and observation about these broad areas?
Yeah, well, there have been some very legitimate concerns expressed pushing back against some of the public health demands to be in constant isolation. And there's no doubt that it takes its toll, as you say, on the mental health of people to have very few social contacts over a long period of time. The effect it has on children and their development. Clearly, there's a price to pay for this in those respects. In actual reality, I can tell you certainly on the U.S. landscape, and I'm sure it's not isolated to the U.S., it's going to affect other parts of the world in a similar way. We have seen a huge uptick in a demand for psychological support services. Every psychotherapist I know is busier than they ever have been during this time. And they're all doing these sessions remotely on top of that. So that almost epitomizes another aspect of the change in our work lifestyle that we have to be cautious about, is that there are no limits when you're working from home. It's very hard to draw boundaries, to maintain a normal rhythm of life separate from your regular work. And there are all sorts of other lifestyle changes that effects it's had. Eating habits have tended to change, not generally for the better, unless you maintain a good discipline. Many people have reported weight gain as a result of this. And in fact, a more serious effect there has been a marked increase in reported number of suicides and suicide attempts across the U.S. as well. So I think one of the ways that we at AXA have dealt with this is to really promote the use of EAP services, employee assistance programs. And what I'm trying to do is to get some data on the utilization of those services obviously in a confidential way. And also, we have been regularly reaching out to our employees with constant communications to give them some form of psychological support and also tips all the time for how to cope with life in this home environment for the most part, in isolation. One of the things that we will be putting out relatively soon, and I think some other organizations have already done it, is, for instance, the ergonomics of your workplace at home. Good seating posture, which I should respect. I don't always do it myself. And the other things that are necessary to keep you healthy when you're working in a different environment like this.
Absolutely, Atlas. Absolutely. I definitely do need a new chair and a properly adjusted table. I don't enjoy working from home, doctor. I don't. But it is the new normal, and I suppose we have to manage that. Now, I like to take the conversation on looking on the global outlook for 2021. So it's a bit of it's not going to be easy to think about what the global outlook would be like. But let's hazard a guess and see what you think about it, especially from the medical and healthcare perspective. The question is everybody's asking is, how long will this outbreak be with us, and how will we manage moving forward if it remains in the way that we are seeing globally? Europe is going through a massive lockdown again, and certain parts of Asia is also experiencing that. So how long do you think this is going to last?
Yeah, well, if any of us had the absolute answer to that, we would probably be very wealthy in the long run because we could plan very accurately. Unfortunately, that's not easy to do. And also, it may not be uniform across the globe. Asia is obviously coping with it much better than the rest of the world. And I think, not being an economist myself, but you can clearly see that they have, certainly China and other parts of Asia, as a result of the way they've responded to the crisis, are perhaps not as severely impacted economically as the rest of the globe. It's unfortunately a little late for the rest of the globe that are experiencing this large second wave to react. We don't know, for instance, if the same measures that Asia took very early with very strict lockdowns initially, very quick reactions to any sign of resurgence, intense contact tracing, and really intense testing, which clearly had its benefits now. But even if Europe or the US took the same path at this stage, the question is, would it be effective? Because the prevalence of COVID among the populations is clearly increased. The amount of asymptomatic infection in the community is now there and much higher. And we're now realizing how important asymptomatic and pre-symptomatic infection is to the perpetuation of the virus. There are even experts now wondering about the practicality and benefits of contact tracing in this situation because the virus is clearly so prevalent. And so the best hope is that we really respect those hygiene measures that work, which is clearly paying close attention to wearing of masks, and other protective things, hand washing, all the things that everybody knows they should do, but doing it meticulously as a community, and also strict social distancing. We can accomplish a lot if we do that. I think we can even probably dampen down the transmission even before an effective vaccine is available. But what the only way this is going to be able to be uniformly sustained is if we avoid many of the activities that people are now getting restless about and reverting to. Social activities, super spreader events, all these things have to stop, or these individual measures are going to have limited effectiveness. Obviously, we're all counting on a vaccine. And actually, I'm very optimistic that we will have probably several effective vaccines available, at least a handful, and that a few of them will be reporting some positive results by the end of the year, and several more by the first quarter of next year. The problem is that ramping up production and distribution will take time. And the World Health Organization's ambition is they'll be happy to get to inoculating 20% of the world's population by the end of 2021. That's not enough to create herd immunity, but their goal there is to at least protect healthcare workers and the vulnerable population as their first priority, and at least give them a chance of getting through this while less vulnerable people may still pick up the infection. Maybe we'll ramp up vaccine production faster than that, but that's their projection. I take some indication from the travel industry, which is one that we support a lot, and their projections are that travel will not be able to return to baseline till at least 2022, and some are going out as far as 2024. If that parallels global response to this, going back to real baseline or normality, I don't know. We'll probably be learning the new normal of having to cope with the virus in the meantime. I think we'll all be wearing masks through most of the next year, unfortunately.
So, bearing that in mind, I mean, I've got two questions, but sort of run parallel, but again, they stand distinct. One would be is, should we have compulsory testing? And in order to make identifying symptomatic or asymptomatic people out there for the purposes of quarantining and isolation. Is compulsory testing viable at all? And of course, in tandem with that, vaccines, would it be affordable for especially third world countries in order to access that vaccines? Because healthcare, as you are well aware, in these less developed places, and you talked about Ebola as well, it has its own set of challenges.
Yeah. The question of testing, that's a very, very hard one. Frequent testing, I think, this is my point of view, has been practical in the countries that got down on COVID very early, because relative to the rest of the world, they did intensive testing. But as long as the spread of the virus was more limited, they could reach those people that were higher risk more easily. I'm not sure that's a practical approach when the virus is so prevalent, when it exists so much among many people. So then I think you focus more on people who do have symptoms or who may report suspicious contacts. But the only way I think you can sustain intensive, frequent testing is to be able to get a very easily accessible, rapid, and cheap test out that's reliable into the hands of people. Presumably, even self-testing would work, but under the current mechanism that most people are getting tested, which is to go to a professional garbed in personal protective equipment, putting a swab down the back of your nose and collecting it, that you can't do on a huge scale on a sustainable basis. So we'll have to see. We are seeing rapid tests, easily deployable tests now coming out with greater degree of reliability. Whether there'll really be one you can go to the pharmacy, pick up, and do yourself, that easily remains to be seen. As far as vaccine availability goes, the COVAX initiative, which is one that's spearheaded by the World Health Organization, along with several other entities, intends to get those vaccines out at an affordable basis. And the plan they have, now whether it's realistic and whether it will work, I'm not in a position to know, but is to make it both available and affordable to all countries equally. They really mean to be very egalitarian about it. And there is a plan for, if I use the correct word, subsidizing the equitable distribution of those vaccines. Now, that's, I said, with the ambition of a 20% inoculation rate over the course of the coming year. It'll be interesting to see what happens, because most of us realize that some countries, generally more developed ones, are separately contracting for a supply of vaccine from the manufacturers directly. But the COVAX initiative is well aware of that and supposedly has a plan to allow those two avenues to coexist and still cover the targeted percentage of the population.
Okay, that's encouraging and good to know. Now, how can governments and public healthcare institutions ensure that there is a collective response? I know you talked about a little bit about this, but but I think there needs to be a collective response between government, public healthcare institutions, and also private sector as well globally. So a collective response between G to G, government to government, region to region as well, should be equally important, because we'll have cross-border traveling and there must be uniformity of tests and SOPs that can work. It seems that there is a need for almost a standard level of care required globally. What are your views on this?
Yeah, it's an incredibly complex question, because it really lies at the intersection of public health, government policy and politics, unfortunately, and economics. And to get all those things aligned even within one country has posed clear challenges, like in the country I live in, the US, for example. But across the globe, incredible initiative. I firmly believe that the World Health Organization really does have in its interest sincerely to get these things aligned. And it dismays me that some countries have decided to opt out of the cooperative initiative that World Health would like to organize, because I think that you really do need to, the only way to hope to get uniformity in the response to the outbreak is by a global organization like this. It's very hard for me to answer at what point you have to strike some balance between the ideal public health approach to stamping out disease and the true devastation that may have on the economic situation, and then obviously the geopolitical situation that follows economic problems. It's a question I can't answer. I can only tell you, as a clinician and somebody who's following the public health recommendations very closely and the research that comes out, what measures are necessary to protect yourself against the virus. And, if it were not that devastating in its consequences, I would say, fine, let everybody get a cold. They'll get over it. But we all know the price we have to pay. And what we're seeing right now is evidence of it. We thought that, okay, maybe now only mainly young people are getting the infection and only a small number of them will suffer the severe consequences. There's no disease that we expect to completely stamp out without some people suffering from it. But when you get to a point where it really takes a toll, and you're at risk of wiping out large segments of your elderly population, of people with any kind of chronic conditions, then I think you have a much more difficult choice. You know, we can all choose to let the virus take its path, but we will pay the consequences. We will see a huge mortality compared to what other diseases cause. And ultimately, to get these things aligned is really a matter of public policy that the public health community doesn't have the ultimate decision over.
Indeed, indeed, it's a challenge for everybody. I think the last question, but definitely not the least, is that do you have any advice for risk managers or insurers and the general public out there?
It's a tough one. I would say one of the things I can advise is that the insurance community would do well to play a supportive role as possible in mitigation activities. You know, you see in other industries where insurance providers will give incentives for good practices, right? In the area of, say, malpractice insurance in the U.S., if you show you've introduced certain measures to avoid malpractice, to be properly educated about malpractice, your insurance rates go down. So what can the insurance community do to incentivize good COVID avoidance practices in the industry? If your business requires a certain amount of physical contact or proximity because it's some sort of manufacturing environment, or it's a certain type of office environment, would you get some sort of incentive from your insurer if you put into practice certain protective measures? I think that would be something that would probably help lower everybody's risk. And then obviously to keep track of the hospital and healthcare utilization, because those are good indicators of something that's going to hit us all down the road. Other than that, I'm not an insurance person. I'm a clinician, so I leave it to the insurance adjusters to determine what measures they think will best protect them. But that would be one of the things I would advocate.
I would agree with you, Doctor. Anyway, the jury is still out, and how insurers and reinsurers will ultimately react to this disease from a coverage point of view, from a claims point of view, and from a cost and profitability point of view as a business. I think we still have some time to go before we have a clearer picture there. Dr. Glushak, thank you so much for sharing with us your thoughts and your opinions with us at this session. This was Dr. Cai Glushak, the International Medical Director and Chief Medical Officer of AXA Assistance and AXA Travel Insurance. Thank you, Dr. Glushak.
It's been a pleasure. Thank you.